Sorry. Good evening and welcome to the Peggy Lillis Foundation's 2021 Fight C. Diff Gala. I'm William Lillis, co-founder of the PLF and Peggy's son. While we wish we could be with you in person, we're glad to be with you virtually. We're also glad that while we continue to struggle through the COVID-19 pandemic, with the availability of vaccines, things are much more hopeful than they were during our last gala.
But we're not out of the woods yet. While vaccination rates in wealthy countries like ours are fairly high, poorer countries are struggling to vaccinate their populations. There is also a lot of disinformation about COVID-19, some of it pushed by elected officials. Beneath what is portrayed as mere partisan rancor is a more disturbing, if understandable, distrust of our most important institutions. And while it does seem that most Americans who have yet to be vaccinated for ideological reasons, there are real obstacles to vaccination for the poor and working class. In particular, the inability to take time off from work and caregiving to get the vaccine, and a fear that possible side effects may make someone too ill to work. In a country with no guaranteed sick leave, this is a very real concern.
You may be asking why we, a C. Diff organization, are talking about COVID-19. Well, because it's all connected. As a plumber for one of New York's largest public hospitals, I have seen firsthand the devastation COVID-19 has caused. I have seen the impact it's had on the doctors, nurses, and other frontline healthcare workers who are exhausted, traumatized, and despite their heroic will to treat patients, probably are no longer performing at their best. 4 decades of cutting public hospital spending, closing hospitals including 10 in New York City, and acting like infectious diseases have been conquered, not only left us vulnerable to the COVID-19 pandemic, but has allowed healthcare-associated infections like C. diff to claim the lives of hundreds of thousands of Americans with little fanfare.
Earlier this year, the Centers for Disease Control reported that in addition to the enormous toll exacted by COVID-19, many of the healthcare-associated and antibiotic-resistant infections like urinary tract, central bloodline, and ventilator-associated infections, as well as MRSA, all exploded as the pandemic took hold. Ironically, for us, hospital-onset C. diff infections were one of the very few that decreased in 2020. That is likely for the same reasons we saw substantial decreases in flu and head colds. People were avoiding healthcare facilities and interacting minimally with those outside their households. But that is unlikely to last as we return to pre-COVID levels of healthcare.
We'll be sharing more about the connections between C. diff and COVID-19 and other infectious diseases, as well as what we can all do to combat them through the gala. For now, let's tell you what's going to be expected tonight.
As in years past, we will be honoring 3 incredible individuals, and though we didn't plan it this way, we're excited that they're all women. We'll share news stories from C. diff survivors who are members of our Advocates Council. We'll premiere our new public service announcement, which I'm super excited about, and reveal the winner of our 50-50 raffle. So if you haven't purchased tickets yet, you can do so right now at the link below.
To kick us off, we're happy to have Dr. James Tercey, the Chief Scientific Officer of tonight's presenting sponsor, Ferring Pharmaceuticals.
Good evening, everyone, and welcome again to the Peggy Lillis Foundation 2021 Gala. My name is James Tercey, and I'm the Chief Scientific Officer of Ferring Pharmaceuticals US. Although we're unable to meet in person, I'm grateful that we could connect virtually to create awareness and support those whose lives have been affected by C. difficile. At Ferring, our mission is to help patients live better lives. We take that mission personally. Like you, we've been touched by C. difficile through the experiences of friends and family, and through our work with organizations like yours, the Peggy Lillis Foundation. These stories inspire us and drive our efforts to help find a way to end the cycle of recurrence associated with C. difficile infection. Tonight, we gather to celebrate your journeys back to health and to provide hope to others that this infection can be defeated. I would like to thank the Lillis brothers, Christian and Liam, sons of the late Peggy Lillis, and the co-founders of this amazing, impactful foundation. We appreciate everything you do for the C. diff community, and we're grateful for your extraordinary efforts. I would also like to thank the C. diff community. We wouldn't be where we are today without your inspiration, strength, and courage. I know there's a great program lined up for all of you tonight, so please enjoy the evening.
Thank you so much to Dr. Tercy and everyone at Ferring. We have other generous sponsors to thank for not only making this year's gala possible, but also free to all those who want to participate. We want to thank Pfizer, Finch Therapeutics, and Summit Therapeutics. We are so grateful to our sponsors and the incredible people who work for them. They are truly our partners in the fight against C. diff. And you can be too. While the gala is free, we ask that those of you who have the means to do so to go ahead and donate right now at peggyfoundation.org/donate. Thank you.
So here's what we have in store for you this evening. In a couple of minutes, we'll be presenting this year's Advocates Award to C. diff survivor and PLF member, Christine Furman. We will also be presenting our Leadership Award to Dr. Debbie Goff and our Innovator Award to Dr. Vivian Liu. We have 2 new C. diff stories to share with you tonight. Later on, we will be premiering our new public service announcement and inviting everyone watching to participate in our C. diff campaign for C. diff Awareness Month. But first, I'm excited to tell you that tonight we have brought back our 50-50. Since we had our first gala in 2010, we've had a 50-50. If you're not familiar with 50-50, that means you buy tickets, and towards the end of the event, we'll be announcing the winner before the end of the gala. Now, Christian is going to share a remembrance of our late advocate, Jessica Thompson. You can read that.
I can't read it. This is coming to you live, folks. Anything can happen. We first heard from Jessica Thompson of Vienna, West Virginia in March 2017. She emailed us to share her story of battling C. diff and seek our advice and help. By this point, we were very familiar with the particular issues of younger people getting C. diff. Most doctors, particularly those outside of academic medical centers, still see C. diff infections as a problem of the elderly and immune compromised. Jess was just 36 years old and had enjoyed good health most of her life. From the initial contact, we could hear Jess's fear, particularly as a single mother to her son Tristan. She'd been battling C. diff for weeks, dealing with horrible diarrhea, vomiting, and severe abdominal pain. It didn't seem that she was getting the care she needed. She wanted to come to our 2017 Advocate Summit, but a recurrence of C. diff prevented her from joining us. With whatever advice we could provide, Jess took matters into her own hands, searching for new doctors, someone who would take her C. diff infection seriously. Jess eventually did find a doctor who helped her, and late in 2017, she participated in sharing her story with one of our sponsors to help educate their staff. A month later, Jess had another relapse. Throughout this ordeal, despite her changing doctors, she was never referred to a gastroenterologist or an infectious disease specialist. Eventually, Jess's C. diff was brought under control, and she was able to join us at our 2018 C. diff Summit in DC. She was joined by her longtime boyfriend, Julian, and her son, Tristan. In person, Jess was beautiful, with bright blue eyes, a winning smile, and a warmth that reminded me of our mother. Tristan was such a good kid, working on his computer, while the grown-ups talked about science all day. We also got to film Jess's story, and the next day she participated in the first ever C. diff Lobby Day. Over the next year, she continued to pitch in as a member of our Advocates Council. Flash forward to April 2019. Jess came to our Summit and Lobby Day. She was newly determined, but also fun in our downtime. What we didn't know at the time was that Jess had been diagnosed with cancer. We kept in touch and slowly learned that she was battling a very particularly aggressive form of cancer. Every time we spoke or texted, she was in full fight mode, But I know that she had her difficult times as well, but she was fighting for her life and to stay with Tristan and Julian. Then COVID came and we were forced to do our 2020 summit virtually. Still, Jess participated, but as the pandemic raged on, her condition worsened. In November 2020, she was recommended to have palliative care. The following spring, her friends launched a GoFundMe to help cover her expenses and secure some money for Tristan. Our advocates all jumped in and donated, wanting to support their sister. I was devastated. How could this tenacious fighter, this true light in this world, be dying? It seemed impossible. At the same time, as a child of a single mother, I worried for Tristan. Thankfully, Julian and their community of friends were there for him. On May 24th, 2021, Jess left this world. I'm not a big crier, but I cried spontaneously for days afterward. Everyone who met Jess through PLF mourned her, so we couldn't let this year's gala go by without remembering Jess. I know she is with our mom, Peggy, and all those that we've lost to C. Diff, and she wants us to keep fighting. We send our love to Julian and to her son, Tristan. So this year's Advocates Award is being given in memory of our sister in the fight against C. Diff, Jessica Thompson. May she rest in power.
Good evening, everyone. I'm Rich Dexter, a member of the Peggy Lillis Foundation Board of Directors. I'm also the oldest child of Judy Dexter, whom we lost to C. Diff in May of 2013. It was our mom's passing that spurred my dad, me, my brothers Scott and Mike, my sister Kirsten, and our amazing spouses and families to become C. Diff advocates. Like most families who battle a C. diff infection, we have never heard of it until Mom was diagnosed. Watching her battle this terrible disease for months was devastating. In her memory, our family started to raise C. diff awareness for the Peggy Lillis Foundation.
In 2014, we were honored to be the first recipients of the Peggy Lillis Foundation's Advocate Award. Since then, it has gone to many deserving people, including elected officials, nonprofit founders, and patient safety advocates. We're humbled to be counted among them.
Tonight's recipient is as well-deserving as any of them. Like Peggy's and our families, Christina Furman wasn't planning to be an advocate for infectious disease prevention and treatment. In 2012, she was busy planning her wedding when a dentist prescribing her clindamycin led to a 7-month battle for her life against C. diff. Despite being hospitalized 6 times, Christina fully recovered following a fecal transplant. She got married to Dane, had a wonderful honeymoon in Sweden, and the following December gave birth to her beautiful daughter, Pearl.
To Christina's horror, Pearl contracted C. diff infection before she turned 2. She, Dane, and her family watched in agony as she endured the same devastating effects. Though Christina was pregnant with her son, Oren, she was a dutiful advocate for Pearl. Like Christina, Pearl's C. diff infection did not resolve with antibiotics. After weeks of suffering, Pearl was finally given a fecal transplant. Today, she is a happy and healthy 8-year-old.
Given her family battling C. diff not once, but twice when Oren was 2, Christina decided she wanted to share her story. She started a website called My GI Journey to share the Furman family's story and provide resources for those in need. In 2017, Christina reached out to the Peggy Lillis Foundation to share her and Pearl's story. In 2018, Christina joined PLF's Advocates Council and flew from Missouri to DC to attend our summit and participate in the first ever lobby day for C. diff.
Over the past 3 years, Christina has become one of PLF's and indeed our nation's most visible and effective advocates for patients battling C. diff. Her many accomplishments include raising awareness in the media, including being featured in Parents Magazine, The Washington Post, and her local newspaper, The Columbian. Christina has also been featured in stories about antibiotic overuse and her local evening news, and even in a Russian documentary. Lobbying for C. diff funding, research, surveillance, and reporting during PLF's lobby days and as a mentor of Pew Charitable Trust's Stand Up to Superbugs program. In February 2019, she testified before the Presidential Advisory Council on combating antimicrobial resistant bacteria. And finally, providing peer support to C. diff sufferers all across the country.
Christina joined the PLF's board of directors in 2019. She is currently co-chair to the Advocates Council, where she is now working with several other members on an eating guide for C. diff sufferers and helping to formalize the Peggy Lillis Peer Support Network.
So on behalf of Peggy Lillis Foundation's board of directors and our whole family, we are delighted and honored to present the 2021 Advocate Award to Christina Furman. Yay!
Good evening, everyone. It's so wonderful to be together, even virtually. I can't wait for the day where we're all in the same room again. My name is Christina Furman, and I'm so honored and humbled to receive the Peggy Lillis Foundation Advocate Award. When Christian emailed me about this exciting news, I had to keep checking to make sure that I was the recipient and not the carbon copy on the email. So thank you so much. To me, being an advocate is about going beyond the stagnant frustration that we feel when we're desperately ill and into the forward-thinking, change, and hope. It's the readjusting of one's focus into converting a painful situation into one that is life-giving. Several years ago, when I reached out to Christian and we had our first conversation, I could tell that this man cared to his very core about C. diff. He and his mother were so very close, and her death was unimaginably hard. His passion was contagious. Christian suggested that I become an advocate, and I did not know what that even meant. Having no experience with that, I felt very intimidated, so I figured I could just share my story on his website. Before I knew it, I was sharing my story on local, national, and worldwide media platforms. I've lobbied on Capitol Hill. I've testified at a presidential advisory committee. I've attended a CDC meeting, and I've talked about all these topics with my neighbors in my backyard. The reason for all of this activity isn't because I have some outrageous story. It's because people care. They care about your story and they care about my story. Each time I feel overwhelmed by the sense that I'm not good enough or educated enough or eloquent enough, I remind myself of Peggy and Judy and Sanford and Gail and the countless others who no longer have a voice. I imagine them prompting me on to facilitate change and to instill comfort and hope to those who are now struggling. To all of you who advocate now or are considering doing so, I want you to know there's nothing special about me. If I can do this, you can do this. Advocacy can be formal or informal, whether on a stage or in an exam room. We all have our part to play in these conversations. Advocates look like family members searching for answers for their loved ones, or sponsors and donors who want to help. Each life that we touch makes all the pain we've endured completely worth it. What you and I do today matters today and tomorrow and forever. I'm so excited about all the things that Peggy Lillis Foundation has going on. We have a new care guide. We have a peer support program. We have a new cookbook coming out and countless other things we've been working on. I thank you all for being here and for caring. And I also want to thank my family who's been so supportive to me and God who has never left my side. I'm asking you all to join me in a promise that I made to myself after Christian and I had our first conversation. And that promise was that I'll never stop. And no matter what, if there is a door open, I'm going to walk through it. Let us continue to look forward where there is life and hope, doing what we can to make C. diff a rare, treatable, and survivable disease. Thank you.
Wow, I have to say that I'm constantly moved by our amazing advocates. From Maryland to Missouri, we're all united in our drive to see C. diff infections defeated. Jenny Feldman has been a fighter her whole life. She was born with temporomandibular joint dysfunction. For Jenny, the joint that allows most of us to open and close our mouths seamlessly and pain-free didn't work properly. She was subjected to procedures to fix it, but has continued throughout her life to battle chronic pain from this disorder. That didn't stop Jenny from building a successful career in entertainment, becoming a mother, and eventually graduating from law school. She has also been an advocate for TMD sufferers, 90% of whom are women. But her experience with TMD did not prepare her for the battle she'd have with C. diff. This is Jenny's story.
Hi, I'm Jenny Feldman. I'm so happy to be here as a member of the Peggy Lillis Foundation Advocates Council, and I'm thrilled for all the work that we're going to be able to do this year to build awareness for the C. diff population of patients who've been afflicted with this disease. I'm hoping that my background in law and policy can help in making a contribution towards building awareness about the disease and regulations. What attracted me to the Peggy Lillis Foundation was the fact that it was founded by a family member of somebody who had passed away from C. diff, and it was Christian's unwillingness to just let this go and know that other families could lose family members, and his refusal to just be silent on the issue because he felt such an injustice in the lack of information and awareness about this disease. And so his energy and enthusiasm for not saying, I'm a victim, this happened to my mom, but my mom inspired me to be her voice, is what really attracted me to the Peggy Lillis Foundation. I look forward to working with all of you, and I know that we are going to make great strides forward this year.
Pharmacists play a critical role in our healthcare system. Understanding and dispensing hundreds of drugs, watching out for interactions or contraindications is a very important job. As patients, we mostly interact with pharmacists at our local drugstore. If we're lucky enough to have lived in the same place for a while, we might know our local pharmacists. We might have a relationship with them and their staff. Perhaps they've helped us get a prescription when we really needed it, or they've caught a potential interaction that might have harmed someone we love. For most of us, that's how we interact with the world of pharmacy. But there's a whole other level of pharmacist work that is vitally important and also out of sight of the general public. There are pharmacists who do academic research, who work in hospitals and pharmaceutical companies, the ones who train the next generation of pharmacists at universities all around the world. Tonight's Leadership Award recipient, Dr. Deborah Goff, is one of these pharmacists. Debbie, as she's known to those of us lucky enough to call her friend, is an internationally renowned infectious disease pharmacist and professor of pharmacy at the Ohio State University Medical Center. She's a founding member of Ohio State's Antimicrobial Stewardship Program and leads the research for the program for the Department of Pharmacy. As we know, the use of antibiotics is the biggest risk factor for getting a C. diff infection. Antibiotic stewardship programs are implemented to ensure that the patient gets the right drug for the right bug, and for only as long as necessary. In a country awash with unnecessary antibiotics, nearly 50% of outpatient prescriptions are not medically necessary. Pharmacists who lead antibiotic stewardship programs are on the front lines of not only reining in increasingly resistant bacteria, but also preventing C. diff infections in their facilities. Debbie also serves on the OSU One Health ASP committee that brings together human and veterinary medicine, agriculture, and the public health experts. She is one of only 10 USO faculty selected to receive TEDx speaker training to provide community outreach talks on antibiotic resistance. She is also a faculty member of the American Society of Healthcare System Pharmacists National Antimicrobial Stewardship Mentoring Program, that is a mouthful, Debbie, that provides on-site training and mentoring to help clinicians learn how to achieve excellence in antibiotic stewardship. She's a faculty member and an international advisor to the Federation of Infectious Disease Societies of South Africa. In this role, she educates and mentors South African healthcare providers about stewardship. She's a 2014 to 2016 recipient of the OSU Outreach and Engagement Grant to provide training and mentoring to South African pharmacists. She received the 2016 OSU Emerging International Outreach Award for her work in South Africa. Dr. Goff has lectured in 6 continents and every state on various ID topics. Her extensive travel provides her the ability to meet antimicrobial stewards from all around the world. She uses Twitter to engage, educate, empower, and unite the global efforts of antimicrobial stewards. She teaches a social media workshop for healthcare providers titled, How to Use Twitter for Antimicrobial Stewardship. The rest of us are just talking crap about celebrities. And she is currently studying engaging surgeons in antimicrobial stewardship using Twitter. She's also involved in the National Research Initiative with Making a Difference in Infectious Diseases. On a personal level, Debbie has been a great friend to me and the Peggy Lillis Foundation. She's a founding member of our wonderful Scientific Advisory Council, but long before we made our relationship official, Debbie was already an ambassador for PLF. Whether that meant retweeting our information, speaking at our summits, or getting me invited to speak at the Making a Difference in Infectious Diseases conference in 2018. I spoke at MAD-ID that year. My husband was there so that we could visit my cousins in Orlando after the meeting. Following my presentation, I received a standing ovation and had a line of 25 pharmacists who wanted to speak with me. I will assure you now, as I did my husband then, that this is not a typical response for one of my talks. But it is a well-deserved response to Debbie's incredible leadership, for which we are honoring her this year. Please join me in a virtual round of applause for Dr. Debbie Goff.
I want to thank the board members and Christian Lillis for selecting me for the Leadership Award. I was thinking back to how I learned about the Peggy Lillis Foundation, and I actually found them on Twitter. Before I follow an organization, I go to their website to make sure they're legitimate. After I read Peggy's story, I was just so sad. She died of C. diff from an unnecessary antibiotic prescribed by her dentist. My husband is a dentist, and I asked him to read the story. I connected with Christian, and as I got to know him, I invited him to the Making a Difference Infectious Disease Conference, attended by over 500 physicians, pharmacists, and nurses who are frontline antibiotic stewardship clinicians. Hearing his story in person was very different than reading it online. I could hear how much Christian and his brother Liam loved their mom and how much they admired her passion for teaching kindergarten students. I also heard how much he missed her. I lost my dad to cancer when I was 19. The night before his surgery, he said to me, "God has a plan for me. If I do not survive, you will be okay, and something good will come from my death." I didn't understand it at the time, but his words ended up being the truth. The death of Peggy Lillis was very tragic, but something great has come from it. During her life, she impacted the lives of many kindergarten children. But upon her death, and through the efforts of her son starting the Peggy Lillis Foundation, she now impacts the lives of millions of people around the world. I will continue to work with my husband to educate dentists on the risk of prescribing unnecessary antibiotics and by sharing the Peggy Lillis story with all the dentists. Thank you for this great honor, and I am so proud to accept the Leadership Award.
Congratulations again to Dr. Goff. After missing it in 2020, this year we have brought back the 50-50 raffle. We will pick the winner in about 10 minutes. Right now, the pot is over $1,000, meaning the winner gets half. And half will go to help us continue fight C. diff infections. There's still time to get tickets and make the pot bigger. To buy raffle tickets, visit go.rallyup.com/fight C. diff. One of the myths surrounding C. diff infections is that it happens to elderly people. Soon after our mother Peggy passed away, we researched C. diff. And all the information said it was the disease of the elderly, but our mother was just 56 years old. Unknown to us, about a year after my mom passed away, our advocate, Ricky, just 23 years old at the time, would begin his own battle with C. diff. Ricky believed that he was colonized with the C. diff while visiting his grandmother in a nursing home. The facility she was in never disclosed to Ricky or his family that his grandmother had been battling C. diff. So when Ricky took antibiotic eye drops a few months after his grandmother died, he soon became very ill with C. diff, and this is Ricky's story.
Hi, my name is Ricky. I am 33 years old and live in Southern California. When I was 23 years old, 10 years ago, I came down with C. diff. I took eye drops for an eye infection. Because I took those eye drops and I'd been exposed to C. diff, I ended up showing severe symptoms. And the C. diff was so bad, it ruined my life. I couldn't leave the house. I had to drop out of school. I was on antibiotics constantly for C. diff, but they didn't do anything for me. As a result, I ended up researching an FMT to go ahead and administer to myself at home on my bathroom floor. And it eventually cured me of C. diff after battling it for almost 2 years. When I was dealing with C. diff, I met with a lot of doctors. It was probably maybe about my 6th or 7th month in that I actually had a doctor ask how I was doing, and I said, well, I'm having some stomach pain, but she corrected me and said, no, how are you doing? And I think she used the word spiritually. How are you doing spiritually? And I broke down, I cried. And the Peggy Lillis Foundation has introduced me to many healthcare professionals, many doctors who have that empathy. And I think that's huge, because if I would have had more healthcare professionals like the ones that work with the Peggy Lillis Foundation, I feel like although my experience with C. diff still would have been bad, it would have been a little bit more manageable. And spiritually, I would have had a little bit more support from the healthcare professionals that I trusted to make me better. And I know that they tried, but I feel like there just was a lack of empathy in that sense. It's a huge milestone that I'm now able to go out and be an advocate and not be ashamed of a disease that took a couple years of my life from me, a disease that actually killed family members of mine. It's the empathy that the Peggy Lillis Foundation has brought to me regarding C. diff that I'm able to go out and advocate for others who may not have a voice.
I'm Dan Friedberg from Columbia University, and I'm honored tonight to introduce a pioneer in C. diff research as our Gala keynote speaker. Dr. Vivian Liu is a professor of medicine at McGill University in Toronto, where she's been for her entire career. But while she's stayed local, her research has certainly traveled. Her work on C. diff has received international praise and has fundamentally changed our understanding of the organism C. diff and the disease C. diff infection. I want to highlight 3 of what I see of as Dr. Liu's key achievements. First, she led the team that proved that a specific strain of C. diff was responsible for the early 2000s outbreak that began in Quebec and then spread across North America. She showed that this strain, which is called the NAP1 strain, had resistance to fluoroquinolone antibiotics. Today, the NAP1 strain is by far the most important strain of C. diff, and knowing that fluoroquinolones were a key part of the problem led to efforts to stop unnecessary use of these antibiotics. It helped to prevent future cases of C. diff. Second, she's done a series of studies that define the key host characteristics that place people at risk for C. diff. Most people get antibiotics at some point in their life, yet most don't develop C. diff. Dr. Liu's work has helped us to understand why some people get C. diff and others don't. Last, she's done fundamental work related to the transmission of C. diff in the hospital. She's shown that people who carry C. diff, who have C. diff in their gut but don't have diarrhea, are also a major source of spread of C. diff in the hospital. Only by understanding how C. diff really spreads can we get past this typhoid Mary vision of C. diff spread and towards strategies that will help to prevent C. diff in the hospital. Her work's inspired me and many other researchers like me. If you read a list of her collaborators and her trainees, it's like a who's who in C. diff research. I'd ask you to clap, but this is via Zoom. So Vivian, on behalf of everyone watching, thank you in advance for your talk this evening.
Hello, everyone. Thank you, Dr. Freeberg, for your kind introduction. I am grateful to Dr. Freeberg for nominating me for this award and to the Board of Directors for their support of my nomination. Thank you all so much for being here at this event. I am truly honored and proud to be awarded the Fight C. Diff Innovator Award from the Peggy Lillis Foundation. I am humbled to join past recipients whom I greatly admire and respect. It means so much to me that the work that I am so passionate about also resonates with you. Receiving such an honor made me reflect on my journey in infectious diseases and C. difficile. 33 years ago, when I entered the field of infectious diseases, I felt very confident that patients with infections could be cured and that somehow we had mastered the microbial world. That confidence was shattered when C. difficile exploded in my home region of Montreal, Canada in 2003. It was a harsh reminder that even well-known bacteria, such as C. difficile, could change their behavior and become an emerging threat. Just to give you an idea of the C. difficile impact, back in 2003, we had rates as high as 20 per 1,000 admissions. For several months, almost every single week, we had 2 to 3 patients who needed a colectomy because of C. difficile. As a physician and as the medical director of infection control at that time, I felt quite defeated. But it was also a moment in time that called for a comprehensive, multidisciplinary approach. We worked with nursing, physicians, housekeeping, and pharmacy to make our hospitals safe again and to do what we are supposed to do as healthcare professionals to get our patients well. We established a regional C. difficile working group that eventually became our mandatory provincial C. difficile surveillance system. It was only through a concerted approach coupled with increased resources and funding that we were finally able to bring C. difficile infections under control, even lower than prior to the outbreak. Currently, our rates are down to 2 to 3 per 1,000 admissions. This accomplishment is not something that I did alone, but with the help of countless dedicated healthcare professionals, and I thank them as well. Despite our current low rates of C. difficile, we know only too well with the COVID pandemic that new strains can emerge and overwhelm our carefully organized control measures. We therefore cannot be complacent, and even one patient with C. difficile is one too many. Therefore, we still need to pursue research in diagnostics, infection control, and therapeutics. Currently, my research focuses on looking at high sensitivity diagnostic assays, antimicrobial stewardship and its impact on the NAP1 strain, and isolating carriers in preventing C. difficile transmission. I applaud your organization for its tremendous support of patients with C. difficile and for keeping C. difficile on the national and international radar. Thank you again for this great honor.
Picture it, December 2019. You've been coughing and have a fever. You feel like you can't breathe well. You go to the doctor and they diagnose you with COVID-19, which is caused by a virus called SARS-CoV-2. You look at them and say, what the hell is COVID-19? Now imagine that you go home, do some research, and find out that the virus you've never heard of has been killing tens of thousands of Americans every year. About 500,000 Americans get it every year, but you've never heard of it. How is that possible? Why weren't you told that hanging out with people indoors without masks could expose you to this virus? How has this been allowed to go on for decades with minimal public awareness and little government intervention? Today, that seems impossible. Over the past 20 months, COVID-19 has been an ever-present part of our lives. We're getting vaccinated, we're wearing masks indoors, we're waiting for our children to be eligible for vaccination. In short, COVID-19 has completely changed our lives. But the feeling of, what the hell is C. diff, occurs every day in this country. This is despite C. diff having first been identified as a cause of antibiotic-associated diarrhea in 1978, over 43 years ago. In 1999, there were less than 800 deaths attributed to C. diff. The new millennium would change all that. Over the next 7 years, that number would increase eightfold to more than 6,225 C. diff-related deaths in 2006. Despite this surge of increasingly deadly C. diff outbreaks, the disease never captured the attention of the media, and therefore the public, as MRSA had, and Ebola and Zika later would. So under the radar, from 2000 to 2014, hospital-onset C. diff cases alone more than doubled among Americans under 65. That's Americans under 65. While numerous doctors and scientists at the CDC and other organizations took note of this rise, there was no effective call to action for the public until after my mother died in 2010 at the age of 56. Today, about 1/3 of Americans have heard of C. diff, but mostly they have heard of it in passing or had a relative diagnosed with it. Last Friday was our mother's 68th birthday. In the 11th year since we have lost her, there have been approximately 5.5 million C. diff infections and 330,000 deaths in the US alone. We can be sure that most of them hadn't heard of C. diff until they were diagnosed. But we can change that, and you can help. In addition to tonight being our annual gala, it is also the first day of C. diff Awareness Month. We're asking you to join us, our partners and our sponsors, in raising C. diff awareness by joining our See C. diff campaign. We launched this month-long awareness campaign in 2019. Last year, we reached over 280,000 Americans. For 2021, we've set ourselves a really ambitious goal of reaching at least 1 million Americans over the next 30 days. We do not expect you to discuss bowel movements at Thanksgiving dinner. In fact, please don't. Rather, we'd like you to visit cdiff.org and join the campaign. There you'll find a bunch of educational graphics, videos, and other tools, including our petition asking the Centers for Disease Control to designate C. diff as a nationally notifiable disease. We will also be sharing content every day on social media. So if you're not following the Peggy Lillis Foundation on your favorite platform, you can go ahead and do that now. We're at Peggy Fund on Twitter and Instagram, and you can find us on Facebook and LinkedIn by searching for Peggy Lillis Foundation. Now it's time for the premiere of our public service announcement, our new public service announcement. Back in 2010, the first thing we raised money for was the first ever C. diff PSA, which came out the following year. That first video was watched more than 60,000 times. Production of this new PSA was generously sponsored by our friends at Series Therapeutics. Series sponsorship will also support paid advertising on social media and YouTube all month long. So we are very, very grateful to Series. In addition to Series, we want to thank our longtime video producer, Richard Davis, for taking such care in telling our mothers and all of the C. diff stories we've produced over the years. Together, we have really made a tremendous impact in raising awareness of this disease. But we want to go further. We want to reach 1 million people. So without further ado, here's our new PSA.
It breaks my heart that my son will never know his grandmother. My mother loved children. He would have been the apple of her eye. But C. diff took her too soon.
Our mother was so strong and full of life, but this superbug came along and took her in just 6 days.
After Mom died, we learned that C. diff infections kill almost 30,000 Americans each year.
Most Americans have never heard of C. diff. This means that people can engage in prevention and struggle to get diagnosed, often with deadly consequences.
You can make a difference.
Join our campaign to raise C. diff awareness. Welcome back.
To our live event.
To our live event. But there's been a few glitches, but I think we've held up pretty well so far. So, ladies and gentlemen, and those who lie us betwixt, we have a winner. The winner of tonight's 50/50 raffle is Debbie Farrell, who's a longtime supporter of the foundation. Has come to almost every in-person gala we've done, so we're really happy for you. Debbie, we will be in touch about getting that to you. And Liam, let's talk about our PSA for a second. So folks have seen it.
Yeah, it was
What do you
pretty
hope
good.
to do next?
I hope they go over, check it out, share it, check out the YouTube, and make some donations.
I'm the fundraiser, but Liam's always the one asking for donations. So if you're watching this on YouTube, please take a moment to subscribe to our channel. The more subscribers we have, the more YouTube will promote all of the educational content we have. That's called an algorithm, apparently.
Thank you so much for joining us tonight. I want to again congratulate our amazing honorees, Christina Furman, Dr. Debbie Goff, Dr. Vivian Liu. Thank you for all you do in the fight against C. diff. Thank you to Jenny and Ricky for sharing their stories and being amazing advocates. And our event planner, Katie Talbert
of Argus
Events, who put this all together.
And thank you again to our presenting sponsor, Ferring Pharmaceuticals, and tonight's other generous sponsors, including Pfizer, Finch Therapeutics, Summit Therapeutics, Tech Lab, Artigen Therapeutics, lots of therapeutics, which is good. That means more therapeutics are coming your way, and the Aaron K. Flatley Memorial Foundation.
And thank you to everyone who donated tonight and bought raffle tickets. We appreciate every single one of you. We've been doing this for a while, and most of you have been with us the whole time. Couldn't do it without any of you. We appreciate that, and hopefully see you next year in person. Good night.
Good night.